Well, in the interest of time, we're going to get started. Welcome everybody. Thank you so much for being here with us this Monday afternoon. My name's Molly Machado. I'm a program manager at the Connecticut Department of Mental Health and Addiction Services, also known as DEMIS. I work with a bunch of homeless outreach programs around the state. And I am so excited today to welcome you to our first session with Housing Innovations. Uh, and I think Suzanne is going to kick off the introductions from the Housing Innovations team. So, Suzanne, I will pass it on over to you.
Thanks, Molly, and good afternoon, everybody. I'm Suzanne Wagner from Housing Innovations. I know many of you and certainly many of your organizations, and just so thrilled to be here doing what we're calling best practices in street outreach, which is really the standards that Connecticut has put in place for street outreach, which are really informed by just best practices in street outreach from around the country. And Housing Innovations has been providing support to street outreach for years in Connecticut and in New York City, and it's really near and dear to our heart. I think it's among the toughest work to do, and we have so much respect for your work and really are honored to be doing this session. And with me today, I have Andrea White, and she's going to be co-facilitating. Many of you know her. She's also going to be doing the communities of practice. Just say hi, Andrea, so your face pops.
Hi.
Yeah, say, yeah, there you go. You might pop up on people's screens. And then Shannon and Quinn Sheeran and Lauren Peretti, who many of you know, who have supported PATH teams for years in Connecticut. And there are other team members as we do support who will be joining us. Sarah Zeiderveen, which is a heck of a last name, had was not well today, so she's not joining us. But or maybe she is. I'm not sure. I did get a text from her. Things are moving too fast. But anyway, we're thrilled to be with you and we'll be the facilitators. We know that you're doing outreach work and we have the most utmost respect for that work. We know it's really, really complicated, that you are dealing probably with the most complicated clinical pictures in your entire community, not just among homeless folks, but among the population. These are folks who've had histories of incarceration, institutionalization, hospitalization, and then, of course, been traumatized and potentially, homeless on and off for years. So we know we have an enormous amount of respect for your work and know that your time is valuable. So you're taking time out. And I think we're excited to be doing this, but we really want the goals for the session is for it to be meaningful to you and hopefully support you in your work, maybe spark some new ideas, maybe you'll make some new connections. We're not going to do individual introductions because if we did all 56 of us, we'd be on here for all afternoon and we know people need you. So we're going to start and end on time. And that's one of our commitments, but also our goals to really provide things that are meaningful to you and your work and make you feel like this was a good use of your time since you have so many other things going on. We love to see everybody's faces, but we also know people aren't camera ready all the time. Sometimes I have to facilitate and I don't feel camera ready. So I totally get it. But especially when we have some breakout groups, if you could turn your cameras on to talk to your colleagues. Hopefully that one of the goals of the training is also for you guys to make new connections with each other. And it's so exciting as street outreach really evolves in Connecticut to bring everyone together regardless of funding source, to have one set of standards regardless of funding source, to really have one learning collaborative of providers and practitioners around this really difficult work. So if you want to change your name or you want to be addressed in any certain way, you can just change your screen name. Otherwise, we'll call you by what we see. We love interaction and have polls, breakouts, lots of ways that we're trying to engage with you because we do really just us talking is not really going to make for a great session. But don't wait. If you have comments or you have something you want to say about something, raise your hand, type in the chat box, just unmute your talk, use emojis, whatever it is, get our attention. I think the slides might already be in the chat because I see something in the chat box. So great. I'm getting a bunch of thumbs up. The slides are there for you to use, share, use with your team. There'll be a recording, as you know, you're being recorded, so I have to watch myself. and they'll be posted on the web. So we know staffing is a challenge. We also know a lot of sometimes you just you get pulled away from a session. You'll be able to review sessions if you want or share them with new workers. So they'll be posted on the web. And there's a lot of slides. So this is a brand new training based on the outreach guidelines and standards for the state of Connecticut. So we did our best to try and figure out how much we could pack into 2 hours. Anybody who's been with Andrea and I know we tend to pack our sessions a little bit. So we may have some slides that we just use for reference, but we're hopeful we can get through the content. And we'll be back together again next week. So if there's something important that we can't get to, we will get to it next time. We want to be flexible. Since this is new content for all of us in terms of really a community dialogue. So we're not going to do introductions of everybody, but if you wouldn't mind, just put in the chat box your name if it's different from what's showing on your screen. I think we might have an iPhone or two on the call today, so maybe unless that's your name, iPhone. And your location where you are. This is statewide Connecticut. Some people may even be outside the state. I'm not sure. Your location and something that makes you smile. We know you've had a busy day. It's the Monday after the holiday. You've had a lot go on already. So just to maybe clear the deck a little bit, think about it, something that makes you smile. You see, dog is my choice. There's a little doggy picture. Whenever I think of my dogs, they make me smile. Same thing with flowers. But if you want to share that in the chat. So your name, your agency, and your role or title if you'd like, location, and something that makes you smile. And now I'm going to look at the chat box and see what's coming in. I see a few things. Okay, fishing. Request for the slides again. Oh, I see they're already there again. Yeah, if you join after something is put into the chat box, it's very annoying about Zoom. Let's record that comment in case Zoom is listening. Okay, holiday cookies. My daughter. I love it. Babies, dogs. Okay, dogs. A lot of dog people. We're going to have a session on pets, so seems like maybe we'll have some takers. My kids. That's good. Sometimes your kids don't make you smile. They give you the opposite reaction. My puppy and kitty. All right. Hopefully everybody's getting a little smile and that's just, clearing your energy to be together today. I know, like I said, you're really busy. Make time with my loved one. It's amazing. So many people said their families after having spent a lot of time with them over Thanksgiving. So that's a good sign. Everybody was careful about what we talked about, right? Helping others makes me smile. And animals. Okay. My children make me smile every day. All right. Well, I know that's a little hokey. I can be a little hokey, but I do find that it helps before a training to just kind of take a breath and think about something positive. So, again, we are really have a ton of respect for your work and so excited to be really kind of going down the road with you on this and look forward to the conversation. So, we already kind of have welcomed people. We're going to do a little bit more introductions through poll in a bit. And we're going to overview the outreach guidelines and standards and kind of the value, the vision, and the goals of them, kind of big picture. What is really the state of Connecticut? It's really been, and these standards were developed through a process over time. They've been around. We'll hear a little bit more about that, but really give you the big picture and then start to dive into really the practice, right? And we all know the beginning of outreach is a relationship. It's an engagement. It's not, still engaging people in a relationship to help them hopefully get housing. So how do we identify people? How do we build relationships? And we know many of you have a lot of experience. We'll hear more about that in a minute. But this is really to make sure everybody's getting the same message, right? And everybody's kind of using similar approaches that are evidence-based practice. And then kind of maintaining a client-centered approach, thinking about the trauma that is really sort of undergirding everybody that we're working with and how that affects the work that we do over time with people. And then we have some closing comments and we have a slew of resources for you in slides at the end. So we'll actually spend a little bit of time going over those. So that's our plan for today. So now we're going to have a little poll, just a little bit more get to know you kind of stuff. which is let me get to the right poll. 2 parts. How long have you been in your current position? And how much outreach do you have in experience, sorry, do you have in street outreach work? And we are guessing that we might have a range, but we'll know from this poll uh, how things are looking. So amazing to have 60 people here to talk about outreach. I'll just say that. That's probably really, really, Molly's getting a big smile there. All right, people are totally Zoomified. It doesn't take anybody people any time to get the polls done. We'll just give you a few more seconds. We already have 45 people out of the 63, and some of us are probably not going to answer the poll. I don't even know how to answer a poll because I'm watching it. But we'll give it up to 60 seconds. All right, great. A minute. Okay. I think we're good. We've got 50 people, which is amazing. So how long have you been? I think I'm sharing the results.
Yes.
Yes. Okay. Thank you, Andrea. How long have you been in your current position? Okay, we've got a couple people less than a month. Welcome, welcome. About 20%, 18%. That's a lot of people are 1 to 3 months. So I guess if we added the two together, we have 22% of people are less than 3 months. About 12 people, 3 to 6 months, 14% of people, 6 months to a year, and half of the people more than a year. We probably need another bucket there of more than 10 years. If you're more than 10 years, put in the chat if you want. I know there are some real veterans here. And then how much experience do people have in street outreach work? You guys can see it. Again, we have a spread longer than I can remember. Okay. That's a few folks. Okay, we definitely have both ends of the spectrum. So welcome everyone. We do have a lot of folks who've been doing it for a long time, and I think that's something about street outreach. It's really hard work, but the people who do it are really committed, and a lot of people stay in street outreach work for a long time. So you newbies, you ain't getting out so quick. This is just the beginning. Okay. Uh, Stop sharing. Okay. Any comments come up in the chat? I can't really monitor the chat while I'm doing the slides. Just okay. Thank you.
Since 1995. Wow, Sylvia.
Sylvia.
Sylvia, you were in grade school.
Huh.
When we started it down here, the first grant, a
That was
Samson grant.
1995. Wow.
Yep, yep.
So 30 years. Okay, we're going to change the scale for the next poll. Thanks. Okay,
Yeah, the last question is going to be as long as Sylvia.
1990. Okay. Well, great. Well, thanks for sharing that. Hopefully that gives you a sense of your colleagues. Again, we really do hope that through some of the breakouts and stuff that you'll be able to meet some new folks. I know also there are Demas outreach meetings, and there's a plan for an in-person meeting this month, right? To do the naloxone training, which is great, to really build a community of practice. And I think that's really also, this is part of really getting people thinking together, talking together, learning from each other, and sharing, especially people who've been doing it. You know, we lots of people with a lot of experience. So, as I said, we're going to kind of jump in on the values, vision, and goals, values and the vision and goals of outreach. And just a little history, there's a link to the standards. They were guidelines, now they're standards. So just forgive language confusion, but they are technically now standards. They originally were written and drafted and adopted as guidelines in the spring of 2022. They've been vetted. There's been some tweaks over time to things as things have been changed, more tools, things like that. And then they were adopted as standards for all outreach. So all outreach programs are meant to follow this guidance, starting this past July. So one of the goals of the training is to make sure you know what's in there. We certainly hope you'll take a look at the document. It's linked in here. Hopefully that's easily accessible to you. And I guess just a key point, there's a summary of changes, which is anything that's green and underlined like this in the training materials is a live link. Let us know if anything is broken along the way. Same thing with the standards. But there is a summary of changes, but assessments and service plans are now required. So that's kind of a big change. And I think really creating a housing focused case management approach, which is what we're going to be talking about really in every session, so that there's some assessment of key areas that are relevant to housing stability and some work to help people connect to their goals, hopefully their dreams, even there might be long-term goals, short-term goals, but connecting people to a process of working with us. So you can see there's a lot of content in here. I'm not going to read this to you, but it does have standards for program standards. I got to move the bar, sorry. Standards for managers, for agencies. So this is something that's meant to be helpful to different people in your organization. I'm getting a couple of nods. It has tools in it. Part of this work and support that Housing Innovations will be providing is to create new tools as you continue your journey, to support you. But that is meant to have, and I think there are some really useful tools, and we'll be pulling out things from the standards for you to see as we go through these sessions. So as we think about the values for Connecticut for the street outreach programs, and I think these values, I know many people on this call, I'm looking at your names and your organizations, and these are probably not a surprise, and maybe they're even really consistent with your own organizations. Hopefully they are. I think it's hard to argue against many of these, but we still will talk about them a little bit. And just even though I feel like this is our shared vision, and Housing Innovations is a group from a lot of different states, but we've been working in Connecticut since the mid 90s, since Sylvia just started. So we talk about Connecticut and we say we, even though we may not always be with you, but I think this is really a set of shared values that it's really underlined a lot of the work in Connecticut around homelessness, not just street outreach, but really thinking about housing first approach, trying to get people. Certainly, we want to provide immediate relief. We want to give people some comfort. We want to give them something to eat. I mean, those are things people need. Gloves, it's cold. But we also really, really want to bring up housing right from the beginning and really be thinking about what is the housing plan with that individual from the moment we meet them. We want to have a sense of urgency. I know that people are struggling because we have limited housing resources. We don't have vacancies. It's a challenge to maintain that urgency, but we don't want people to spend one day longer homeless than they have to, right? And I think with the shortage of resources, and I get this, I'm a practitioner, social worker, I've done direct service. So is Andrea. We forgot to mention that in our background, but we are social workers, is that it is tough when there are limited resources, and it means you have to use your creativity. And I know nothing's creative like outreach work, frankly. And engagement is really a creative process. And for some people, trying to figure out their housing options is going to take a lot of creativity because we have limited resources, right? And trying to balance that, but we don't want to lose that urgency and really think about, is there something we can do to help this person get into housing as soon as possible? We want to remember that people have been, and this comes up later and all throughout the training and all the conversations and the standards, is that people have been traumatized. 100% of people who are meeting in street outreach have experienced some trauma or another. It's just a given. I mean, maybe somebody's going to come and tell me, no, we have one person who never had any trauma, but by definition, when you're living outside, you're experiencing trauma. They're scared, frightening things. And then some people have really deep, obviously, histories of trauma and physical, mental, emotional abuse, maybe as children, maybe in intimate partner relationships, maybe related to substance use. So giving people choices, respecting them, respecting their perspectives is all part of being trauma informed. Respecting people's property, right? Even though it may seem like junk, what people have, it's important to them. And losing that junk, quote unquote, could really trigger a huge sense of loss for people, right? And so this is everything people have. And we know these things and think about that. But that's undergirding everything is really keep that respect going, building relationships that are transparent with clients and partners. This is a very, in Connecticut, an approach using a really a can-based approach so that you're geographically coordinating your outreach and that you're working with your partners who are doing outreach. Some communities have more teams than others, but also you're partnering with FQHCs, you're partnering with mental health services, but really having transparent relationships with clients and with partners. It's really about relationships. Again, something I think many of you value already. Becoming allies with clients, we're working with them to achieve their goals, starting where they're at. And, people may just say, I'm not really ready to talk about housing today, but what is in that lunch bag? Okay, maybe that's the beginning of the conversation. But you're gonna bring it up, right? But we're gonna meet people where they are. Well, you want to know what's in my lunch bag? What do we have today? Right? We're gonna talk to people about what they want to talk to. We're gonna hear what their concerns are, and we're gonna try and connect around that. We'll talk more about that. Andrea will talk more about engagement. We, of course, want to minimize risk and reduce harm for everyone. That includes the people we're working with, the participants in outreach, staff, everyone, right? So we're always assessing safety. That'll come through as we talk about the practice. We are thinking about the things, I think about the naloxone session is kind of perfect that's next week, I think on the 10th, isn't it, Molly, or something like that? But that's about reducing harm from substance overdose and really critical because if you're outside and you're maybe alone or just with a friend and you can't get to the hospital quickly, having that naloxone is going to be really helpful. But we are looking to reduce harm wherever we can. That includes from freezing to death, right? So that's why the warming centers come into play in the winter and getting people who may be outside in sub-zero temperature. But we're looking at reducing harm, minimizing risk, being safe throughout and in all engagements, right? And helping people be safe. And that's important in outreach that workers feel safe. Can be difficult going out on outreach and sometimes you're exposed to situations that you're uncomfortable in and it's important that you realize that for everybody safety is important and we're also assessing risk to participants when we see them outside and maybe they've moved location and maybe they've changed who they're hanging out with and maybe that new person they're hanging out with is maybe a predator or maybe we know that, right? So we're always paying attention to what the risks are around folks. And then, of course, trying to be fair, create equal access for all people of all different races, ethnicities, sexual orientation. It's a very long list. I'm sure someone can quote it, but create equal access for everyone, be consistent. We don't have different standards for different people. If anybody objects to any of these values, you can put it into the chat box or wants to comment on any of these, please feel free. We are going to give you a chance to talk about them, but I'm definitely realizing I'm talking quite a bit. This value is related to what we talked about before is we're working in a network. We're not working alone. No outreach worker is solely responsible for housing someone, right? Like Andrea, I often use Andrea when we co-train as my client or participant, right? I may be the primary worker, but she may be engaged with, the health. She may be engaged with the VA. She may be engaged with mental health or healthcare service that we're working together. And no one, we are interdependent in trying to address street homelessness in the cans that we work in. That also, too, since it is hard work, that you need to take care of yourselves. Laugh, smile, have a break, eat turkey, whatever, do things that make you happy. Get supervision and support, which we talk a lot about. And this training is going to have special sessions specifically for supervisors who don't usually get a lot of support. So there'll be some support for supervisors so that supervisors can provide support to workers, but also do things that take care of yourself. Think about that. And that's really, really, really important because this can be high burnout work. It can be very hard for some people to engage, right? It can be hard to get people into housing. So we want to make sure we're putting gas in the tank. That's what I call it, self-care. although maybe that's not such a good analogy, but if we don't have, and feel nourished, it's really hard to give to people. And especially the folks who are working with an outreach are usually really needy and have a lot of needs, and they need a lot of support. Andrea, did you want to say something? I just thought you were going to speak, but
No, I think I think that one of the things that's really important as being part of a team and recognizing other people's roles, such as mental health or other people's roles, is then we don't feel like we're in this alone and that we're solely responsible for everything for the person we serve. And I think that's often overwhelming for outreach workers. And you don't have to do everything. I know it's more work to coordinate with all these other services, but you know what? You don't have to do everything, and that it's not the expectation. So, one of the things that these standards strive to do is be clearer about the case manager's role. And, otherwise, when I was a first a case manager, people said, you name it, we do it. Well, that's almost impossible, right? So it's really important, that part about working with these other services.
thanks, Andrea. Yeah. And I think it's perfect segue into being flexible and creative, right? And I think
Yeah.
we know working with other people, we come up with other solutions that we might not have thought about, right? And I always feel that way when I talk with a team and we brainstorm that we come up with solutions. And these are really challenging situations. There are things that come up that you may not know what's going on with a person. You may feel stuck, like you don't know what to do. So working with others helps us be able to be flexible and be creative because we do have to do a lot of problem solving and outreach. And of course, it's Connecticut. You do have great data, but keep it up. Keep Now there are new ways for outreach to enter data because there's an outreach app. So you can enter data right on the street, right? Yay. Everyone who wants to applaud about that can applaud. Hopefully making it easier for you to capture the data that you're required to capture, because data really tells a story. Data enables us to get more money for programs. Connecticut was really successful in getting extra money for outreach, like $8 million, I think, or so, a year. So I'm not my numbers are always are off today, but anyway, quite a bit of money. And part of that was having good data, having good results, but also having good data and being able to demonstrate needs. So we want to use that data to collaborate. We want to use it to improve services for people, right? So if Andrea keeps popping up in different cans, even, for example, that's always, I think, an example of something too. We won't know that if she's not in HMIS. She's that type. As soon as you get close to her, she ducks out.
It's true.
Uh,
So there's some questions about the app, and Molly had mentioned that they're still refining it and it's going to be offered to outreach teams soon.
okay.
So somebody asked what the name of the app was. So it's not quite available, but it almost is.
Thank you. Sorry about that. Well, I'm glad I got some people excited about it.
Yeah.
Okay. And then the last value is to plan with your partners. There are requirements about doing plans for the jurisdiction and thinking about how the different players, and every can is different, right? And it's a little different layout. So of course, different geographies. And then there's also different team configurations. But the idea is that you're planning, you're coordinating, and really covering the whole area, but also working together so that you're not duplicating efforts, right? And that you are taking advantage of resources that agencies have and going to strengths in that. Okay. And then just quickly, the vision is to help people achieve some sort of permanent and sustainable housing. Well, that's big surprise. That's what Housing First is. And the goals, which are translate into program outcomes. And we're going to talk more about those in depth in the supervisor session. They're included here in the resources because some people I know love data. But the goals are to quickly connect people to housing, income, and supports, find people who are unsheltered, make sure we know who is unsheltered, reduce gap duplication, which we just talked about. That's what the coordination is about. use resources strategically, right? We have limited resources, so how do we use them in a way that's going to get the maximum use out of them? Teach people tenancy obligations. I think the great thing is to get people into housing, but the greatest thing is for them to be successful and stay there, right? So we want to teach tenancy skills. That's a part of the work, and prepare people and then help them stabilize once they move into housing through using a warm handoff and or aftercare. And we'll talk about that when we, not today, but we'll talk about that and how that looks depending on where people are going. That warm handoff and aftercare may look different if someone's in PSH site versus out in an apartment on their own versus in some kind of a supported housing. So there are goals for all of these, that the metrics that are turned into metrics. You put the data in, and then hopefully the reporting should be set up that the reports come out. That's the wish, isn't it? Let's see if you shaking heads. Thank you. Okay. So we want to give you guys a chance to talk with each other, to meet each other, and to share a little bit about your backgrounds. And so we're going to randomly mix you up in breakout groups. So talk a little bit, of course, introduce yourselves. You probably don't know each other. Or maybe you will know people, depends. How and when did you come to work in street outreach? What do you think about what we just talked about? Those values, that vision, those goals in the guidelines. What do you think about them? Or do they make sense? Are there some things that seem harder, that some things that seem easier? Are there questions about what these things mean? Um, Take a little time. We're not going to do like a formal reporting back, but it would certainly give room for people to share what came up in the room, and certainly we want to record and address any concerns and questions that come up. So let me just got a lot of rooms because it makes breakout rooms very difficult when your microphones are not working. So welcome back, folks. We had a couple of technical difficulties for some folks with their microphones. So we'll need to do some thinking about that, and make sure that we make this accessible to people and try to figure out what to do about it. But for those of you who could talk, we hope you had lively discussions. I always love to hear anybody want to share their feedback. I know a lot of names, and I know many of you are very not shy people. That now that we've been, kind of living with these values, I guess it's a couple of years, right? And I know many of you really use the guidelines or the standards regularly in your outreaches. What do people think about them? Are there things that seem right? Are there things that seem hard? Or are there questions? Love to hear a little bit from you guys. Just raise your hand. If you want to talk, please, would be great. Oh, the shy people came back, huh? Is that
I
what
put a real hand up.
All right.
All right, Sylvia. Okay, Kelly, you're next.
Okay.
Go ahead, Sylvia.
I was at a meeting up in Boston the week before last, and we were talking about training and manuals. And I said, "Oh, I have a manual that you have to look at that's laid out so nicely. They
Oh,
use the right font, the right colors. I mean, really, it's big enough to read, and I'm sensitive to that. And it's broken so that it speaks to the right audience. And there's not a million pages. Take a look at it." So that was at BU, and it's John Snow, JSI was there too. So I shared it. I shared your document with them just so they could
your
see how.
document, right? It's everybody's document in Connecticut because that's how it got put together. So it is really impressive. We do work nationally. I think many of you know that. It is way, in the field. People are so impressed. So thank you for sharing that, Sylvia. Kelly.
Well, it was good to hear that all of us seem to have good communication with our cans with regular meetings. That helps so much with referring, like you were talking about. And we also agreed that one of the biggest struggles we're having is helping people self-resolve without referring to them to vouchers when vouchers aren't available. We're applying for everything that's posted on the Housing Choice Voucher if people are willing to move to those areas. People seem to know the eligibility criteria for vouchers, so they'd rather stick it out than couch surf or go into a family situation that they don't think is going to work long term, or SROs that they could afford. So getting people to self-resolve outside of the voucher system is an ongoing challenge for us.
Yep.
Thank you for sharing that. Yep.
Oh, and
And
the food I brought back from CT Boss to Liberty Commons was very well received, by the way.
wonderful. We had a in-person semi-annual meeting at CT Boss, and the food went back to Liberty Commons, right? Isn't that where it went? To Liberty Commons, which is a PSH project. So they had Nardelli's,
Oh,
uh, yes, and beautiful donuts from Waterbury. What's the bakery name?
Brooklyn Bakery.
Brooklyn Bakery. Okay, great. Okay, so people are okay, there's no reactions or their questions or thoughts about this. I think it in the values, if we wrote them again today, I guess I think the one thing I think about is elevating the voices of people with lived experience. So when I look at those values and I think about it's embedded in there, I think, but just to really think about one of the changes I think that's really happened over the last few years is we're really looking at how do we engage people who are receiving services in feedback on the services and input on the services, and because there'll certainly be an annual survey for people to give their feedback in. But we are, looking also always to incorporate people's feedback in the programs. And that's not explicitly stated, but it's in everywhere, it's in everything. Am I missing anything? Anybody? Nobody else wants to talk? Okay. Okay. So just to, kind of really, again, this came up during the breakouts, and maybe it's worth saying, it is a balance in the standards of having standards so that people are treated equitably and services are the same if I'm in this can or that Eastern can or Northwest can or wherever there are standards, but that it is also an individualized process, right? And that every person is different, every person's journey is different, and every person's needs are different, right? So, but that we really do want to focus on ensuring consistency for people. And so, kind of the key roles and responsibilities that workers have is to make sure who's living unsheltered, having a canvassing schedule, maintaining partnerships, responding to referrals, making contact and establishing relationships with people who are living unsheltered, right? That's earning trust. And Andrea's going to be talking a lot about engagement, being consistent, and being kind and helpful, right? We'll talk more in the next session about what is housing focused case management. We know many of you do housing focused case management. Your organizations have been doing it for a long time. Again, Connecticut has been a leader in homeless services and has embraced housing focused case management in all of its programs. So we'll talk about that in session 2, talk about working with the partners and safety and harm reduction and the data. So that's just kind of making sure you have a sense that we'll be covering. We're trying to cover all the content, but these are not the last trainings. We may need to go back and go, deeper on things, but we are trying to really give you a good overview of the standards through the session. So we have another poll, which is written on the screen, so you could read it while I get it up. Is which statement about, and the polls are anonymous. Just want to say that. So feel free to tell be honest, I guess, which I'm sure you are all the time, but sometimes, depends on who's in the room. But which statement about the street outreach standards is most true for you? Which of the one? And it could be one of five. Today is the first I'm hearing about the standards. I knew something about the standards before today, but I'm not using them yet in my day-to-day work. I'm very familiar and using them regularly with some frequency. I'd like to learn more about the standards, which may be, even if you've been doing that, that's where you're at, or other. Okay. You guys are quick on the polls. I didn't even barely finish reading it and 40 people already responded. So I'll give it a full minute. It's only 50 seconds. Okay, great. All right, I'm going to end the poll and share the results. So it's pretty new. Some people are really new. We know that. There are people here who've been here a hot minute. So for some folks, it's the first they're hearing about it. Sorry. Um, for about 10% of people, you knew something but not using them, but 61%, which is amazing, are using them with regularity or frequency, some frequency, which is terrific. They really have only been official standards slash requirements as of July 2024. So we're doing great. And then people want to learn more, which is great. We're trying to make it accessible. I know that this is a very mixed group, but outreach workers are a particular type of person who does outreach, and it's not a person who wants to spend all day reading usually. And Sylvia's points I think are really well taken about trying to make it easy to read, easy to use, giving you something that can really help you in your practice. So, okay. So I'm going to turn it over to Andrea, who's going to talk about really the nut, as we say, engaging relationships with people.
Okay. Thanks, Suzanne. So let's get into it and talk a little bit about engagement. So developing the engagement or the relationship with a person is the primary purpose of those early contacts and throughout the work. You want to know why they're going to engage with you. People, Suzanne said this is earlier on, is that sometimes, their stuff is really important to them and they may perceive you as somebody who's going to take away from their stuff. You want them to perceive you in a positive light. And why would they engage with you? Because you can help them get the things that are important to them. So that's what we're going to really talk about. So let's talk a little bit about day one when you're first engaging the person. Um, it's the next slide, so people can, yeah. So day one, we're going to really engage the person, and we have to be aware of the trauma, right? And trauma can be caused by a multitude of things. They could have witnessed violence. They could have been a subject of violence. They could have been, had gotten emotional abuse. Or as Suzanne said, it's really important. In one of the breakouts, they came back to the main session and people said, we need to treat people with respect and like human beings, because homeless people often feel invisible and that nobody listens to them. And that can be really traumatizing. And that can be a form of emotional abuse. There could be physical or, medical neglect. There could be sexual or physical abuse. Poverty is very abusive and will show you a lot of trauma. How does trauma affect people's homelessness? That's what we're going to talk about. Does this look familiar to y'all? People, when I was running a shelter, somebody came in actually from the Department of Mental Health and said, how many people have trauma reactions? And I said 150%. And that may be low. And that was absolutely true, is that people had been subject to so much and feeling out of control. Okay, thanks, Alejandra. So let's talk a little bit about trauma and homelessness, right? So that we talked about that most people, all people who have experienced homelessness have experienced some form of trauma and continue to focus to experience some form of trauma. And that can really interfere with people's sense of safety, right? They can feel very out of control. They can feel like that whatever they do doesn't matter. And that can result in all sorts of reactions. And that's really important to take a look at. That's why you're going to hear about consistency and setting expectations of the work with the worker and being very clear, because those are all things that make people feel safer. Trauma can also affect people's interpersonal relationships. They can see most interpersonal relationships may be transactional because that's what they've been subject to. They may have trouble self-regulating. It may be they may be quick to go to a panic mode, or sort of back off and sort of flop down mode. And that one of the things we have to remember is there are principles that are in common for helping people who have been subject to all sorts of trauma. And one is really paying attention to safety. Most people's safety is primary. They just want to feel safe. One of my clients once told me, I would just want to take a breath. And in order to take a breath, you have to feel safe. So you want to emphasize safety, and you also want to be predictable about what you can offer and what your conversations are like. There should not be a lot of surprises. That makes people feel out of control. You're going to emphasize that they have a choice and help them rebuild that sense of control. Offering multiple choices. It doesn't mean that people can do anything. It just means that, when what you've been talking to me about, reaffirm that you hear what they're saying, and that it seems like there might be a couple of things that we can help you with. Which of these interest you? Or maybe none of them. You want to also be aware of triggers and avoiding re-traumatization. And you want to be careful of people feeling like people are taking things away from them, which goes back to the stuff argument, and that they have to do something that's uncomfortable for them in order to get things that they need. And that's really important, right? And that people have a choice in how they move towards helping themselves and letting us help them, and that we want to reemphasize that all the time. And then we also want to help people identify what they're doing well and how they've mitigated some of these responses that they're getting in the community or in a service program or in their life, and really talk about this and talk about building their own skills. People often don't realize how important some of their skills to deal with people are. And you'll hear us all along saying, go with people, see what they do well, reemphasize those skills. If we reemphasize those skills, people are likely to do them again. And they realize that within themselves, they have the power to change some outcomes. And that's a really important perception in helping to move people forward. We want to build the relationship, which is the next, yeah, unless you have something to say. We want to build that relationship. Number one is be yourself. People want people who will look at them, who will respect them, but they know if you're being authentic. And that's a really important part of it. People don't want to deal with people who they can't trust, right? Let's go back to the safety again. We want to show up, and we want to always follow through promptly. Showing up is really important, and we're going to talk about that in more detail later about how to figure that out, especially in the first visit. We're going to listen and identify what the person wants or cares about, right? We talked about there needs to be a reason that people engage with you, and those things they dream of are really important. And as you said, it may be they want a voucher, and then you want to explore that a little bit. What's the thing about a voucher? Is there anything we can substitute? These are the eligibility, right? We want to talk about, if they want a house, if they want a house, it may be so that they think that only people with houses can keep their dogs. So we're going to talk about that, the things that they want, and we're going to really listen to what they're saying. We're going to provide some concrete assistance for comfort and survival and safety, like food and clothing and gear. We're going to pay attention to what their needs are and what they're asking for. Prevention, disease prevention, the Narcan training is so important, making a harm reduction plan so that people can live long enough so someday they might change their relationship with drugs or alcohol. We want to help people with documents. People know that the documents are important, and what can we do to help people get those? So we want to provide that concrete assistance, and more importantly, we want to work on those things together with the person so that they understand the worker's way of being, so it becomes more predictable for them. And finally, we always want to attach housing to their goals. It's a way to get what people want and what they need and get their needs met. And you know what? The goal may be a Section 8 certificate or a house. And that might be long term, but we want to connect how housing now will help them meet some of the other things they were talking about and also get them on a path to reach those longer term goals eventually, right? So we want to pay a lot of attention to how housing connects with what people want. And luckily, housing connects to almost everything, right? Having a base in the community is really important. Okay. So the other thing we want to do is really pay attention to race and gender and ethnicity and how that might affect people's perceptions and the things that they want. And we're going to ask to hear about that. We're not going to know everything, but we're going to ask about their experience. And we're going to ask about how that impacts engagement and what would help and who have they trusted before and how has this worked. We're going to offer as many choices as possible, and we're going to offer as much information as possible. So you're going to hear later, and Suzanne mentioned that one of the things that we're going to do when we provide case management to move people towards housing is really educate people about what all the options are. Why is that? Because otherwise, if we narrow it down, people never feel like they're getting the full story. So we're going to talk about that. We're going to talk about how people, can connect. Okay, KG said people often prefer certainty of misery over, yeah. People absolutely, people need a way out of misery. No one chooses misery, right? But they may choose predictability and they may choose, that old expression, that old time your grandmother probably said, better the devil you know than the devil you don't. It's the uncertainty of what we're offering that people are rejecting. It's not the certainty of their misery, right? Nobody wants to sleep outside all the time. If they have a viable option, the question is, what's their viable option and can they keep it, right? One of my clients once told me the meanest thing you could do is offer me housing and then take it away. And I was sort of stunned, right? So I thought, you know, why would you think I had enough power to take anything away, right? But you know what? That wasn't really the answer. The answer was that had been based on their experience, and that was really scary for them. So we had to really listen to that and talk about what their rights are and how they can keep their housing. And it took a lot of discussion so that people are afraid of uncertainty. That's for damn sure. But you know what? Once people understand the options and believe the options and trust the options, they're much more likely to take them. And I think that's what this is about.
Yeah, I
The other
think that's
thing
what
is,
KG, I just want to say,
yeah,
I think that's what KG's message is, right?
yeah,
That
good.
because you're offering housing, are you really offering housing? I've heard that line before,
Yeah.
and then it's a shelter maybe, or so that, what you're offering has to really be clear and, not nebulous. KG, I don't know if you want to speak. I mean, I love hearing
Yes.
anybody but us talk. It's always my
No,
favorite thing.
no,
Yes,
basically
KG.
that's the
Yeah.
same thing that I was kind of agreeing with.
Yeah.
Just following like what is it, Maslow hierarchy and needs, when it
Yeah.
comes,
Yes.
people definitely want to make sure that the basic needs are secure. And
Yep.
then everything else can kind of build off of that. So, it is important that we build strong relationships and make people feel that they can trust that we're actually there to help and that we're going to be, like you said, to have things removed in different situations, make a person feel like maybe I don't want to trust this organization, or maybe I can't rely
Yep.
on you guys to kind of do the things that you say. So it's important to say the things that you're actually capable of doing and following through.
So really, yeah, that's
And if
exactly
you
it.
make a promise, right, and then you don't
Absolutely.
follow through, I mean, it's all in there, KG. You
Yep.
could be doing these slides, right? Because you know this work, right? That we're trying to really fill in the information and give people the best information we have, right? And not give them empty promises and break that relationship, right? And also not ask people to take risks that they're not prepared to take, right? And that's also part of respecting choices, right? It's not that risky to move into housing, but for somebody who's lived unsheltered for many years, it's very risky,
Hmm.
right? Because it's the story that made them homeless before, right? And there's a lot of risks in there. And we want to respect what people are ready for, right? We have many stories. I don't know if we have time, but there is a building in New York City that was dedicated for people who lived on the streets for a very long time. And when they first opened, um, they took all the longest of the long-term people living outside, and the property manager is an amazing man who had done the work for a very long time in PSH. And he said in the first year, 10 people came and gave their keys back and said, "We're going back outside." They were like, "We're going to quit this before we fail it or before you kick us out." Right. And he said, "You know what? Your rent is paid to the end of the month, whatever. I got the keys here. Okay, you go give it a shot." But all but two of them came back, right? And it really was rated to their fear about living in housing and all
Yeah.
the uncertainties associated with it, right? So even living outside, you know where you're going, you know your routine, you know who's out there, you know everything. You move into a building, you don't know who your neighbors are, you don't know that neighborhood, you may not know the street. So I really like what you say because it shows so much respect for what we're offering, right? We're
Yeah.
offering something that seems very clear to us, but it raises a lot of questions for people. So Sylvia raised her hand, and then I'm going to look and see who's next. So Sylvia, you're next. Oh,
One of,
Claudette, you're after Sylvia.
I think one of the things that is really vital to do is to be honest with people and put things in context and in perspective. I know how many people are waiting for a housing resource, and I know how many resources there are. And the number is valuable for our clients to know. If we have 600 unsheltered people in our region, and every 2 weeks when we meet, there's never more than 10 resources. We've got to get real about something else. And it's not fair to have people make the choice, oh, I'll just wait for something to come up. No, I can set up this thing so that you're still eligible, and it's just scary. And people need to know the forecast out there, not to make them feel terrible, but to have them know the reality of it.
And to know it might be a process, but I like what you said, which is that they may take another resource and they can still be eligible for this
Right.
resource that they prefer, and they may be able to work towards those resources so that sometimes, people have to try something else, right? In order to get that resource that they want and that they don't want to stay on the street. And that's a long conversation. And everybody may not choose that right away because there's all sorts of what I call jailhouse lawyers out there telling them, oh, if you take these other options, you'll never get the first option. But you know what? That's not true. And that you're right, you can make people long-term eligible, but having that conversation and also making suggestions about what could be done in the meantime is a great thing.
In the meantime,
In the meantime, this
all of
is
our
not their
programs,
last option.
this is our program in outreach. In the meantime, all we're doing is in the meantime.
Well, I'm not sure that's all you're doing. You're also setting the tone for the system, which is huge, right? And, and helping people trust, which is big. And also offering people real concrete options and helping them. That's a big thing. I'm sorry, Claudette, you wanted to say something.
Hi, hello, Andrea. I wanted to say that once people do finally get housed, um, for a lot of them, that is the biggest, greatest challenge because now they're off the streets, they're
Yep.
under a roof, and they become distressed. So everything comes out. And it can be a lot, it can be overwhelming.
Sure.
Not only that, they now have to manage paying bills, doing grocery shopping, if they have children, shopping for the kids, getting up for school buses and just sort of like time management and everything. This is a really crucial time in their life also for them where they
Hmm.
also need the largest amount of support just as much as they did when they're on the
Yep.
streets.
Yep.
Otherwise, they become so overwhelmed
Yep.
that they just give up and end up right back on the streets again.
Yep. And I
Uh,
also think that I mean, you put it really well. It's a really hard transition, and the expectations are very different. And you know what? All of those things that they have to do are not fun, right?
No,
They don't give them any joy. And
no.
that's the other reason why we really emphasize you're going to do some goal setting and you're going to figure out what people want and you're going to help them see the progress that they made because
Mm-hmm.
housing alone is not going to change that perception.
No.
It has to be connected with people's goals.
And we want them to maintain their
That's
housing
right.
as well. So rent has to be paid and bills have to be paid.
Yep.
So,
Which
like,
is not
it's
a
a
time in the
lot.
month I look forward to. I don't know about you all, but
No, definitely not. And the systems that set up is worked against a lot of people to fail. And we don't want that to happen.
I
so it's
think
that.
I think an
Yeah, go
important
ahead.
thing to remember is the folks we work with out on the streets don't have the same reality as we do. They're living in a survival day-to-day situation. We're living in a survival month to month. How do we pay our bills? How do we get ahead next month? How do we do this and that? And that's just not the reality for them. Their reality is, how do I get through today and make it to tomorrow? So when we come in and we say, hey, we can offer you housing and all this stuff down the line. I mean, their ability to wrap their head around what's going to happen a month from now, 2 months from now, 6 months from now is just their experience has mostly been constant disappointment. So their focus is on trying to get through today. And then when we are able to house somebody, it's like Claudette was saying, it's like their mindset is still in that how do I survive today mode. They're not planning on paying their rent next month. They're not planning on paying their electric bills. Like that's just a reality that has become so unfamiliar to a lot of the folks we help that like we need to find a way to support them throughout that transition to make sure that they have the
Yep.
ability and the space to change their reality so that, yes, I am now a productive member of society. My situation is now a month to month situation as opposed to day to day,
Which is
and just kind
huge.
of extend their windows of responsibilities greater and greater and greater until they can become independent. But I think a big area we fall short is after we house people, we're kind of just like, see you later. And then we end
No
up.
question. But I think you're both saying that is people need an enormous amount of support. I also want to highlight something you said, Seth, is people are moving from a crisis mode to we're helping people be more planful. And we
Yes.
have to be aware that being more planful, maybe 2 minutes at a time, right? And that we always want to keep that in the back of our mind. And we want to keep that hope in the back of our mind. And we want to keep that reinforcing what people are good at. And that's all part of the process. But I mean, all of us agree people need huge help during that transition because it's a lot. It's a lot, right? I mean,
Mhm.
if anybody's moved lately, you know it was a lot for you. Imagine if you're coming from a different place.
I'd like to also add that, like, most of us are in this job because we love what we do,
Yep.
not because we love the pay.
Yeah.
And so a lot of us are housing insecure ourselves,
Yeah.
especially like caseworkers, like the people who have their foot on the ground, you know. So we kind of know what it's like for them, because like for those of us who are housing insecure, even though we're housed, like at any given moment something can happen where we could be out there right with them, because housing is so unstable right now. So it can happen to anybody. So I think if anyone has the most support and sympathy for them is a lot of people in that situation, or people who know of people in that situation, who know that like any given moment something could happen and you could become homeless yourself, or how it is for these people who are on the streets because you have been homeless yourself.
Yeah.
So I just wanted to add that part.
No, I think that's really important. And I think there's a range of experience and people really use it well. But it also speaks to case managers need a lot of support to do this work. So some of
It's
it's going to
hard
get
work.
really, it's hard work and that
It's
you
hard
love the
work.
work,
And
but it's,
acknowledging the uncertainty is a
yep,
part of the
yep,
engagement process,
yep.
right? Like empathizing with the person who's looking at, as Seth said, they're thinking about today and you're trying to talk to them about next month and really
You can't.
empathizing with where they are. And
Mm-hmm.
that's why we're trying to provide immediate comfort and relief. We're trying to help people build their confidence, right? And feel like that they have a sense of success so that in the relationship building, we're also doing building work to help them feel stronger, right? Because this is overwhelming. It is overwhelming to lose your housing. They've lost their housing already. It's overwhelming to move into a new housing, right? So much of building the relationship is really about helping shore up that person's um resources, whether it's being warm, whether it's having some money, whether it's having being able to organize a meeting with someone, is really building up their strength, because uncertainty really topples you over, right? It really knocks you over.
Financial
Sorry, Andrea.
planning is very important for them because they're going to have to learn to budget.
Yep.
Some people like don't even know how to write out a money order or a check. They may not know how to use Apple Pay or some other app or whatever. So these are things that like we're going to have to take time to teach them. Or if there's someone out there teaching it, sign them up to do these classes to get them prepared for like living in a home versus living on the streets.
There's going to be a lot of skill building. You're right, Claudette, because it's very different living on the
Yeah.
streets and we're living off the grid and living on the grid. Really,
Mm-hmm.
it's a big difference. And making those resources available and also being really patient because you're right,
Yeah.
it's going to take a while.
Mm-hmm.
I also think that applies to if people are having psychiatric or substance, any behavioral health symptoms, and you're trying to figure out what's going on, you want to seek assistance with that. You want to, if you have a clinician in your agency to help you to see the person, to offer assistance, we can get people to the assistance, but I think it's not a reasonable expectation of case managers that they provide the full range of assistance, nor are people trained to do that. So that it's important to hook up with the case managers. Molly has offered, I know in the past with outreach, and she has offered here that mobile crisis will come out and they can provide case consultation to you and the person. But if you're having trouble with that, please call her and let her know. You also absolutely have to remember self-care so that having those clinical resources can be really helpful, both to the person we serve and to the case managers. Um, you also want to seek as much information as possible from the CAN, from HMIS, from the police, from, any mainstream or homeless service providers. You want to seek as much information as possible, both what services, how the reaction to services is, what happened, because the more you know, the better it is, right? And then finally, what you guys have said over and over and over again is you got to keep your promises.
Oh, yeah.
And I think that that's really important because trust and safety are really the fundamentals of the work that we do. And in order to trust you, you got to be around, right? So that's really important. Okay. So we've got some breakout discussions. So what we want you to do is break up in groups. So the people that don't have microphones working, I realize that the chat does not work just for the breakout room. Maybe you want to stay in the main room. Um, but you want to discuss a person who you're working with who has difficulty engaging and ultimately connected with. So we want to take a look at that. Molly just shared a file. Um, what are the engagement barriers and how did you overcome these barriers? So somebody who it took a while, but you had real success with, what was happening with them and how did you overcome that? What connected them to you? So you want to take 10 minutes, Suzanne?
Yeah.
Yep. And we'll break you up in groups.
So the rooms are open. If you don't have a mic,
Right.
just I think stay here
Yeah.
and um you can add comments to the chat if you'd like, or you could go, I guess, and listen.
Yep.
Actually, maybe that's right. We don't have to say that. If you
Right.
want to go and listen to a group, but know that you can't talk, we'll just monitor to make sure no group is full of people without microphones, which we did
Right.
find last session that there was one whole room where no one had a microphone. So there was nothing to listen to. It was easy to get agreement in the room. Okay. Let me check and see how we're doing here. Anybody having any issues getting to a room? All right, let me share to the breakout groups because that's not the default.
Hello. Welcome back.
Everyone's back now, Andrea. The breakout rooms are finished.
Great. So welcome back. We're not going to fully debrief this, but does anybody have anything to say about something they heard or something they said about sort of overcoming some of these barriers and engaging somebody? Anybody have anything they want to share that they heard? No? Okay. Give it a couple of seconds. Des, did you want to say something? Saw you unmuted. Nope. Okay. All right. Okay, so what's really important is you guys are infinitely creative, which we were talking about actually in lieu of the technical difficulties that we had, and that really listening to other people about how they do that can be really important. So, how do we know if we're successful? Number one, if the person wants to speak to you again, that's huge, right? If the person actually wants to speak to you again, that's great. And that you want to really try to engage people within that first 24 hours, just get some sort of connection there, some sort of thing that you can pull on the next time you see them. And then you want to engage them again within 2 days. You want to let people know when you're coming. Even if people say, I really don't want to see you. Well, how about I come by and how do you like your coffee? And let's chat a little bit and see what's going on. Um, you want to re-engage them. You want to keep that momentum up. You want to make sure to follow through on your commitments. That's the keep your promises. And then we really want to use those warm handoffs, particularly from the places that we know people have used before. So we're going to use some of that time to connect with other places. We were just in another meeting, and Suzanne was mentioning that most people who live outside have been in shelters at one point or another. That might be a good place to start. And we can find that through HMIS and how people reacted, what they liked. We want to be careful to ask those questions. We want to ask them of the people we serve, but we also want to ask them of the positive, and that we want to really warm hand off them from the other services. It's always nice to meet them. We want to make sure that we want to even make a promise to bring coffee or, something to make a blanket, socks, something that would make them feel more comfortable and make that connection that way. And we want to really further this conversation. So that's
I
really
think so.
important.
For people who are newer, a warm handoff is, not just gloves in the winter, but that's definitely part of it. When we have people outside, but is if we are, for example, maybe you have a veterans outreach worker and
Yeah.
you determine the person's a veteran and you're going to connect with the veterans worker, you would go and make the introduction so that it would be a three-way encounter. Just I know probably 99% of you know and use warm handoffs all the time, but I do know we did a poll and a few of you are very new to the practice. So that's really transferring engagement. And when we
Yes.
have a relationship with someone and they're starting with a new service, we are kind of like the reference for that new service. There is somebody here who's really a great specialist in veteran stuff. I'm going to connect you up with, whatever the person's name is. And we're going to meet together so that you could start to build that relationship because sometimes we're not the best person. And so we just engaged somebody. We gave them our heart and soul. We were funny. We were nice. We were warm. And then we say, but I'm really not the best person. Right. So we want to use the warm handoff. And I'm probably not going to be doing many warm handoffs right after day one. But if we are, because somebody may have an urgent need and we need to bring in a doctor, for example, or something like that. But we always want to transfer that engagement.
Absolutely. And you know what? Don't underestimate how much comfort that brings with people. It's hard to engage with people. And once they trust you, that warm handoff is really going to bring a lot of comfort. So, what are the things, right? How do you finish that first day contact? So before leaving, you want to offer something that would reduce the person's risk, harm, or comfort. Did you do that? It could be socks. It could be that referral Suzanne talked about. It could be a bunch of different things. But did you do something that increased people's comfort? And then did you really look around? That's really important, right? Look around, do a 360 scan of where they live, how people interact with other people. That's going to be really important in building that relationship. And you sort of see their way of being, which is really important. Okay, so if you believe when you're doing that 360 scan or when you're talking to the person that you're an immediate risk, get out. Call 911, get help if 911 is the most appropriate, if there are other places that can do it, right? But if you perceive immediate risk, we want people to pay attention to what they're feeling. Talk to your supervisor, right? Because that's an important part of self-care. You want to ask yourself, did I get that person to talk to me? You know? And it could be about anything, but did they tell you something that was important to them? Did they admire how you're good with colors and they're interested in colors? That's something that's really important, right? Did you talk about what they need? What do they need in terms of moving forward? And it may be a little early to talk about ID or social security card, but how can we help you? A really common need people have is more money, and that's a good way to really start that conversation and bring in the ID and the social security and stuff. Um, did I ask that person about do they have enough money to live on? Do they have money that they can meet their needs with? What are their needs around money? That's really important. Did the person have military services? We're looking for more contacts. The other things we want to ask, and those are on your assessment, is, we want to let them know if we're at a certain place every week, where they can find us, and if they're not in the place where they usually are, how we can contact them. That's really important. It may not be forthcoming at first because that's a big act of trust, but you want to ask those questions. And it really shows a commitment to follow up. Okay. So before living, you want to maintain that client-centered approach. And I've heard it from you guys all through this training, and I've heard it from you guys for years, is you got to treat people with respect. You got to look them in the eye if they're comfortable with that. You got to, really see them and let them know that you're listening to them, right? You want to offer services multiple times. People may not, because a really good point was made, is people may just think about survival this afternoon or there's a snowstorm coming, right, KG? You want to talk to them about, what are the services, but you're going to keep doing it. You're going to keep offering the services, right? Because people may need to hear it a couple of times. You're going to understand what their perspective is. And you're going to listen to why they don't want to use some services. And we're going to start that negotiation process, right? Because every service is not the same. And the people don't necessarily have to go right back to a service or a resource that hasn't worked for them. Encourage them to talk about what they're looking for, and maybe we can make a better connection. We're going to advocate for people to really work with the people that we serve, make sure the people are getting the services they need. Also talk to people about their rights and how they can address that if they don't feel like they're getting the things that they need, and how they can do that. The warm handoffs that Suzanne talked about can also really help with that, because we're going to ask people those questions and we're going to pass that on, which is part of passing on the engagement of what they're really looking for in a service. We're also going to assess people. We're going to assist people in accessing temporary accommodations. Remember, this is just the first step in permanent housing that can accommodate their entire family. So we're really going to listen to that, because people may want other people to live with them, and it's very common that people want their pets because they're an important part of their family. So that we're going to listen to that and we're going to talk to them about that. And as Suzanne said, we've got some real detail on that in the future.
I not to interrupt you, but I
Oh,
actually
you're good.
saw something, and it's funny because the more that I had this conversation or hear you guys discuss, including pets and things of that nature, there's my dog is to me. I've seen recently,
Yeah.
I've seen commercials that say there's something called a Purple Leash Project that's supposed to be something that helps provide housing or even temporary housing for individuals who have pets. So it's called
What
the
a
Purple
wonderful
Leash.
thing. That's a great resource.
Yeah.
Thank you.
I
Purple
haven't
Leaf
looked it up
Project.
yet, but it's come up on the screen a
Okay.
couple of times, so it's definitely something to kind of.
Look that up. Thank
That's
you.
wonderful. You know what? That's a really wonderful thing about some of these meetings, is you guys sharing resources
Yeah.
with each other, and that really helps. And yeah, a lot of people won't go anywhere without their pets. I don't have a pet right now, but let me tell you, I would not have gone anywhere without my dog. Nowhere. Right? So that was really important. Okay. So these are tools, right? They're in the handbook, they're in the standards, and Shannon has put them in the chat again. So we talked about some of these, right? The reducing, did you offer them something to reduce their risk or harm or discomfort, right? And then after this Narcan training, it may also be Narcan, right? And the harm reduction plan. Did you revisit their plan to end their homelessness? In other words, we're asking everybody what's their plan to end their homelessness. And that's how we find out people's long-term goals. Every plan is not realistic, but you know what they found is most people have a plan. So we want to ask them, and we're going to revisit that plan and what do they need help with, right? Once again, giving people control, it's their plan. And that if things have changed with their family or their friends, could they be a source of safe housing? A lot of times people are ashamed to go back to their family, or they're worried their family will reject them. And you know what? They might. But it may change as people start to feel differently and feel more in control of what they are able to do and know more about their skills, that this may be revisited. So it's not over if you ask them the first time and they say, no, that's not a possibility. Want to bring it up again and see. Did I commit to coming back? And when, right? So that's really important so that people can expect you. One of the women I worked with in the streets one time, I went to see her at 10 o'clock, 3 days a week. And one day she said, I can't talk to you today. And I thought, really? Okay. And so we rescheduled and it changed things. And later she told me, she said, I was sitting in what was really my house. I know it didn't look like a house to you, but it was my bench, was my place. And you just walking up there was really hard for me. And that I wanted to tell you that this is my place. Okay. Right? Okay. So that predictability, the negotiating it, what works for you, it's respectful, right? And it also gives people you have a sense of who they are. Did I revisit benefits or income? I can't say enough. Income is often the thing that engages people, right? Because people need resources to get the things that they need, right? Did I get their consent? Did I offer them options, right? They may not take them. You may not be able to set up the appointments, but if you can, you can, and that's great. But if you can't, will they consider it? Are they thinking about it? And then within 72 hours, you want to write down the commitments you made so that you can follow up on them. Because I know you guys don't only have one person you're working with, right? So it's hard to keep it all in your head. So writing it down and having some trigger system so that you can really follow up on these commitments is really important. Okay.
And all through the standards, there are tools like this, the first contact one, the
Yeah.
in-between contacts. There's some other things in there. I think especially when you're new, it's a great reminder, just kind of quickly scan the checklist and think about it. I think also saying when you're going to be back always, and
Yeah.
if you have regular places you hang out, because I know some
Yep.
of the teams
Yep.
regularly go to a soup kitchen or a shelter or church or certain locations. So you want to let people know that if you have a regular spot where they can find you and whatever your, obviously your cell phone is.
Okay.
So.
So we're going to close it up and then Suzanne's going to talk about some resources that are available to you. So building trust, that's huge, right? It's the foundation of outreach work. So that's why we're spending so much time on engagement and building that trust. You know that. Permanent housing, a place where they can stay, their base in the community. I refer to housing as the shoes that people wear to walk forward in life. And that they've got to have those sturdy shoes. And that's something that's a primary goal of outreach. And we're going to offer, as we said, over and over and over again. And as KG said, I mean, they may not trust it. They may have had different experiences. We're going to talk about that. We're going to talk about rights. People may not accept it on the first thing. In fact, it's pretty rare, right? But we're going to keep talking about that because that's the foundation. If we believe that everybody deserves a safe base in the community or housing, that's important. We're going to think about the impact of trauma and how it affects people's behavior and other life experiences interfere with relationships, including the relationship with us. And we're going to take that into account. We're going to be consistent. We're going to be reliable. We're going to be kind. And we're going to be helpful. You know, they did a research project on a drop-in center that we used to run. And one of the things that they found is that people said someone to care about me and someone to believe in me and how powerful that is. What was the most helpful thing is having somebody believe in me. So we want to reinforce that hope, right? And we want to believe in people even before they believe in themselves. We want to focus on what's most important with the clients, and those take multiple conversations. And what brings them joy or relief or peace, right? We want to talk about that to people a lot, right? So that that can be integrated into the plan. We want to know the implementation of the outreach standards is required for all COC and DMIS funded projects. And we want to take a look at the standards. And you know what? Everybody is open to any suggestions or any additions that people have. And we want to say how much we appreciate you doing this work. This is indeed the most important work there is. And thank you. It's
I
been a
think that,
pleasure.
the relationship building, which
Yeah.
is, the focus of today, everything can flow from that, but nothing can flow without it, right? Like that. We did spend a lot of time talking about relationship and engagement, and it is I said, the heart of the matter. I guess kind of how I think about it, and being prepared. And I think too, as a worker, that you may not be the best person to engage somebody, right?
Yep.
And you may be a trigger, right? You may be exactly not the right person. And Andrea talked about paying attention to that with people. And our goal is to connect. So also, how do we build in the flexibility in the team and not take it personally if we're not the best person, right? Because that's going to come up. Also, sometimes just because of race, ethnicity, background, trauma, person, I can't really work with a female worker. I can work with a male worker, right? There's different issues that come up for people. So I think that it is really the reason we've spent so much time is because it is the heart of the matter is still the relationship. And there's a great article that was just in the Times about a street psychiatrist and engaging with a very, very psychotic man. And I don't know if people saw it, but we'll bring that reference to folks. But I think it really shows in the writing how it can be so difficult. Somebody can be in such a place that's so difficult to engage. And it was one of the best kind of summaries of that. But we know what you guys are doing. So, and we know that it's really hard. So you need some additional resources and you need us to end on time because you have things to do. So speed talking for additional resources. We've got our next session is next week, same time, same channel, 1 to 3 next Monday. The other dates will be announced and we'll be announcing them next time. So you guys can put them in your calendar. There is a community of practice next, I think that's Thursday. Isn't that right?
Yep.
Is that
Yep.
the 12th? So that's an hour with Andrea. It's kind of like, an open item to talk about things, and talk about cases and situations that are coming up. So those will be held quarterly. So there's the link for that. Next, just the week after December is full of resources for you, is an naloxone training and resource fair in person at Lee Auditorium at Merritt Hall on the 17th. So no Zoom link for that because it's real live people. All right. There's the quarterly outreach meetings, which is another great resource and an opportunity for everybody to come together and talk with Molly and Brenda and Alice usually are there. We're there also to hear about resource needs. So that's on March. And there's your contact information. Lauren and Shannon and Alethea and a few other folks from our team worked out on training inventory that's available. Again, remember, this is a live link here. So there's a training inventory and links to trainings that are free. I think they're all free. Yes. Yes, Lauren's shaking her head. But you can see engagement. Some of them are things we've done too in other for other trainings. Some are other people, but you see there's quite a list of things and resources out there for you. So that was so people could meet that long list of trainings that are recommended in the standards, right? So that's an important part of it. And then there's some other articles, and some of you are readers. Sorry, having to move that bar a lot. Acronyms, everybody's favorite, ABC, chicken soup. With not chicken soup. What's the soup with all the letters in it? Anyway,
Alphabet
alphabet
soup.
soup.
Alphabet soup.
Alphabet soup. That's it. And so definitely some great reading there, in there. And then these are the outcomes that we mentioned that you will talk more about, but just for those of you who want to see what the outcomes are, that we're looking at, those are the DEMIS, and then the SNOFO, the ones that are funded through HUD, have some other outcomes in them. They're really focused on getting people housing and resources. I'm not going to get into all the details today, but you can see also spending your money is an important outcome as well, and people not coming back to homelessness. So in the 1 minute we have left, is there anything burning that anybody wants to raise? Of course, anybody can stay on longer than that, we're happy to.
There was a question
Um,
in the chat about when is the training going to be
yes.
available, the recording. Up, here we go. It's most likely to be posted by this time tomorrow. There we go.
Okay, that good question. Anything else? Okay, we want to just make sure you have our contact information. That's the last slide in here. So you can reach out to any one of us anytime for questions, but we're going to see you all next week. And we want to thank you for your time because we know that you are busy and you have a lot going on, and we'll see you next Monday. Like I said, same bat time, same bat channel.